How many kinds of therapists are there? What's the difference? Hello, my name is John, the Millennial Therapist. Today, I'm going to discuss the different kinds of therapists and mental health providers that exist in America. I will identify their titles, general educational background, and their treatment styles and categories. By the end, whether you are looking for a provider or looking to become one, you will have a general understanding of the differences. There are a lot of credentials and acronyms out there, so if you're confused, this video is for you. Broadly speaking, mental health providers can be split into two groups, what I'm going to call the medical providers and the behavioral health providers. The medical providers will be those who mostly focus on prescribing medication and provide actual medical care, while the other will be non-medical personnel who provide talk therapy and behaviorally based interventions. The medical provider types are frequently conflated with therapists as a category, and vice versa. However, psychiatric nurses and psychiatrists are not therapists. They typically do not provide talk therapy services. Technically speaking, nothing stops them from doing so, but given their educations and expertise, it does not remunerate as well as medication management, which is typically what they're engaged in, though not always. While some psychiatrists and psychiatric nurses will offer some behavioral health interventions during their brief medication consults, they are primarily prescribers. Psychiatrists are medical doctors with a specialization in mental and behavioral health. To become one, you need to attend medical school. It is the most intensive career pathway, though it is also the best remunerated. You can medically treat people, offer medication, and if you want, provide therapy in addition. Psychiatric nurses or psychiatric mental health nurse practitioners, PMHNP, require a graduate level education as well, and they too can prescribe medications at the highest level. If they want, they can perform talk therapy, but I've never known one to provide it formally. They really operate more like a psychiatrist than a therapist. Now, I will describe and differentiate the true therapists. When I say true, I do not mean better or superior. I'm simply referring to professions in which the sole focus is talk therapy and behavioral health interventions, as opposed to medical ones. Let's begin with the psychologist. A person with a bachelor's degree in psychology is not what anyone would consider a proper psychologist and cannot offer much in the way of formal therapy. So I am going to skip to those with graduate degrees. Psychologists with a master's degree can provide therapy and at times diagnose, but not always, and the situation depends on state laws and supervision policies. The remaining set of psychologists all have some version of a PhD or what is called the PsyD, which is the more clinically focused version. They can all diagnose and provide therapy. Some of them, with special training and education, can even prescribe medications depending on state laws, though I'm pretty sure this is rare. PhD level psychologists are typically the best paid of the therapy providing practitioners. Their education is longer and considered more intensive. Though to be clear, merely because a person has a doctorate level psychology degree does not ensure he or she will be a better talk therapist. Now, let us review the master's level therapists who make up the great majority of talk therapy providers. None of these providers can offer medical care or prescriptions under any circumstances. All of them can provide therapy, though they do not always, depending on a slew of factors. Licensed clinical social workers, or LCSWs, require graduate degrees and at least 2 years of clinically supervised practice to become independent providers of talk therapy, in which they can diagnose and treat mental health conditions. The LCSW title varies a bit from state to state, but the Board for LCSWs is a national organization making most state-to-state transfers of licensure fairly easy. Some states engage in tedious gatekeeping, but in the majority, the LCSW probably has the easiest time moving licensure around. Licensed professional counselors, or LPCs, and licensed marriage and family therapists, LMFTs, must also have graduate degrees and between 2,000 and 4,000 hours of clinically supervised work, depending on the state, in order to gain full independent licensure, very similar to the LCSW. This, at the fastest, is usually about 2 more years in addition to the graduate degrees. Postgraduate supervision varies from state to state and from board to board, but it is more or less as I have described. And afterward, all these therapists, LMFT, LPC, LCSW, take an exam before completing licensure. Do not get confused by the acronyms, though. All of them provide proper therapy and will be more or less accepted and approved by insurance, though there are always exceptions. If you have family or couples related issues, the marriage and family therapists are likely the best way to go, though many other therapists provide the same services. As for which one is the best, none are in particular. All these providers are capable of providing effective therapy. It really just depends on the individual providers, their intelligence, experience, and skill sets, as is the case in all professions. If you are already in therapy and are not sure if your needs are being met, then look around, check out for other providers, and don't get confused by the different acronyms that are out there. All the ones I mentioned in this video can provide talk therapy, and now you can even distinguish between those that provide strictly, or most likely strictly, medical services. Thanks for listening, and be sure to check out my other videos, and be sure to like and subscribe. Goodbye.